Hello, my name is Valerie Mallard, and I am a student at Liberty University. I am in the Masters of Public Health program with a concentration in global health. And today I will be discussing my practicum project. On the cover slide, I have included a picture of the Wellness on Wheels mobile community service van, or what I will now be saying WOW van or WOW program for short. The WOW program was initiated by Bridges Healthcare Incorporated. And on the second slide, I will outline Bridges agency for you. Bridges Healthcare is a nonprofit outpatient mental health clinic that serves families, children, and adults. Their focus is evolving from mental illness and substance use disorder to now include physical health, which captures a more holistic approach. And by doing this, they now have Genoa Pharmacy and Optimus Healthcare on site. Bridges serves 3 towns in Connecticut, which are Milford, Orange, and West Haven. And on the next slide, I will discuss the WOW program with you. The WOW program was implemented to go into West Haven neighborhoods in order to reach adults with mental illness or substance use disorder. These adults may have a hard time accessing medical care due to different circumstances, such as barriers with transportation, with financial situations, or due to their disabilities. The WOW program has 2 staff members, which include a registered nurse and a bilingual medical assistant, which they both conduct intakes, physicals, and health screenings, which may include A1Cs, blood pressures, EKGs, and even pregnancy tests. They also provide health education regarding the patient's diagnosis. They are able to refer patients to specialists and other community resources such as AA programs, shelters, and food pantries. The design of the program can be seen on the next slide. The WOW program understands that people with mental illness have a higher rate of diabetes. The population struggles with finding appropriate care. They may lack the knowledge or awareness of proper disease management. Some patients may have a limited health literacy due to their educational levels. Therefore, the aim of this program is to provide education to these patients in order to increase their health literacy and to promote self-management with their diabetes. I have listed the objectives in order to meet the goal on the next slide. These 7 objectives guided me through the development of my health brochure, and they include reviewing and analyzing scholarly and government information, as well as websites such as the American Diabetes Association and the CDC. I was able to pick 6 health topics to include in the brochure, which also contain culturally relevant information as well. I recruited 5 individuals to do a pilot test of my health brochure and conduct a 1-hour focus group to discuss their findings, and I finalized the project by making the appropriate changes to the health brochure. As we move ahead to the next slide, I have summarized what I have accomplished during this practicum project as well as the practicum itself. I have spent time researching and reviewing resources from government and scholarly websites. I have used this information to design a culturally competent health brochure regarding diabetes. I use this health brochure to educate patients on their diagnosis. I also help educate them regarding other factors such as nutrition, how to track blood sugar levels, and linking them to primary care physicians or specialists. Within the agency, I was able to present my health brochure to different departments, and the Behavioral Health Home Department, will now use this brochure to educate their clients as well. I have attended several health fairs in the West Haven community, which allowed me to network with other community providers and community members. I was able to give tours of the WOW van to community members and provide them with the services that will be conducted in the van. I was also able to provide community resource information to whoever had asked at the health fair. I used data resources such as America's Health Ranking, Kaiser Family Foundation, the CareLogic electronic health record, and Excel to complete data analysis tasks, which was primarily for my preceptor. And these data analysis tasks were to examine the relationship between diagnosis and age, gender, and ethnicity. As we look to the next slide, you will see a layout of the health brochure. I wanted this health brochure to be fun and inviting in order to capture the reader's attention. And by doing this, I used soft-colored background and colorful images. These images reflect what the texts say in order to reinforce the message that I was trying to send. I also used bold and underlined text in order to emphasize key words or phrases that I thought would normally be used in doctors' offices in order for the reader to feel comfortable with this vocabulary. I used simple information regarding risk factor, complications, self-management, the connection of the mind and body, and how different cultures are affected by diabetes. Moving on to the next slide, I have learned a lot in this practicum. One of the things that I have learned was how difficult it is for patients to comply with medical recommendations or even follow-up visits. And I believe that some patients just are not motivated in their recovery, or they might not understand the severity of their illness. I also understand now how difficult it is to manage diabetes when you are living on a limited income. This program was brand new to Bridges, therefore I was able to learn how a program is developed from the ground up, and this included aspects such as the hiring process, doing inventory of medical supplies for the WOW van, and even the protocols to fulfill the grant. In the beginning of this practicum, I did speak with my preceptor, and I told her that I was not too confident with data analysis, and because of this, she supported me and coached me by giving me training materials such as e-learnings in order for me to feel more comfortable and to develop my skills with data analysis. And I'm very thankful for this, and I'm thankful that she did support me and listen to me when I said this. And now I feel like I understand different technologies such as Excel a little bit more. On the next slide, I will focus on the challenges that I have faced. Since this program is brand new, it was not fully operating, which had prevented me from interacting with the patients as much as I had wanted to. I only saw short-term goals, such as the development of the health brochure, but I was unable to see long-term goals, such as the effectiveness of the health brochure within a patient's self-management journey. And one of the hardest challenges was finding medical professionals that accept Medicaid, since a lot of our patients are on Medicaid. A lot of these doctors that take Medicaid are either too far from the clinic or they just do not provide good quality care. And for me, this was frustrating because I feel like everybody deserves good quality health care. And because this was just something out of my control, it has to do with insurances and doctors and federal government. So this one was pretty tough for me. And I just want to say thank you for listening to my presentation, and thank you for this opportunity at Liberty University. and also within this practicum. And I had just wanted to say that I have learned a lot, and this has just been a really great experience overall. So I hope you have a great day. Thank you.